or you know someone whose connective tissue isn't quite right, these are the kind of people who need to be seeing this video. And when I say their connective tissue isn't right, or isn't quite right, what does it look like? So here's a CT myelogram again, but instead of cutting across, we're cutting up and down. And what you see here is the spinal cord in the middle, and here's the bones that make up the spinal canal on either side. The white stuff here is contrast in the spinal fluid, and I've blown up this section here on this image here so that we can get a look at what's different here. What do we see here that we don't see down here or down here? What we see here, these kind of lobulated structures that have the contrast in them. The contrast is no longer confined just in the bag of fluid. It's starting to get into these nerve root sleeves and these dilated, bulbous-looking structures. That is essentially an aneurysm. It's an aneurysm of the bag of fluid. It is an aneurysm of the thecal sac. And what we call that, sometimes they'll call it a meningeal diverticula, sometimes you'll call it a dilated nerve root sleeve, sometimes they'll call it a perineural cyst, but what it really is, it's not a cyst in the way that most people think of a cyst. This is an aneurysm, a little ballooning outpouching that's formed where the nerve has to poke through the bag of fluid. Remember I told you that nerve had to poke through the bag of fluid and it creates a little weakness? That is what happens when that weakness causes a defect that grows and grows and grows. And like a balloon getting blown up, it gets thinner and thinner. And eventually, it can do what you would imagine. Especially, imagine you've got one of these things and you get in a whiplash accident and your head jerks back and forth. Well, this isn't in the neck. This is down in the thoracic spine. But imagine that happens. And imagine the seatbelt hits you hard and compresses your abdominal contents, and you get a pressure wave going through your spinal fluid. And that pressure wave hits one of these things, and poof. Now you've got a spinal fluid leak. And people are wondering why you're having all these headaches and neck pains after a car accident. They don't go looking down in your lower back. And this is what it looks like when somebody operates on it. So here what you see is the spinal cord's running along up here, and it's a little hard to see on this television, but where the nerve root is coming out here, you have this lobulated aneurysm coming off another kind of lobulated aneurysm that had developed a tear across it. So here's other people who we've seen just in the last 6 months whose connective tissue, again, you get the sense that their connective tissue isn't right. So here's somebody's bag of fluid with contrast in it, and then you see here at the bottom, it trails off the way it's supposed to, but then there's this other thing that's not supposed to be here, filling with contrast, with kind of poorly defined borders. And I've blown it up over here so that you can see this has actually been connected, and where a nerve root is supposed to come off down here, they've developed this kind of aneurysmal dilatation at the bottom of their thecal sac. And not only that, but their little aneurysmal dilatation has developed an aneurysmal dilatation. All right? And that has 3 feet of water standing on top of it. What happens when this guy coughs? So how do you know